Hello and welcome to everyone across Europe, tuning in for today's critical journey into men's health. I'm Dr. Lauren Pierce, renowned urologist and men's health specialist, working with patients from Berlin, Zurich, Milan, and beyond. Countless men, like Eric in Stockholm or Lucas in Milan, have come to my clinic with quiet suffering, feeling resigned to waking up several times a night, believing declining sexual health is simply a consequence of age. Today, I'm here to reveal the urgent truths hidden behind these symptoms, and most importantly, how European men can reclaim vitality through science-backed lifestyle change and cutting-edge medicine. Let's begin with hydration, the most underestimated factor in prostate health. Hans from Hamburg, a banker in his 70s, believed that reducing water intake at night would help. However, what happened instead was the concentration of urine becoming acidic, attacking the bladder's urothelial lining. Acidic urine acts like a chemical irritant, triggering inflammatory cascades within the bladder and adjacent prostate tissue. European Association of Urology guidelines state that chronic dehydration is a leading cause of benign prostatic hyperplasia, BPH progression. For optimal hydration, aim for a urine color that is persistently pale yellow. Use the sip throughout the day method recommended by German and French urologists, which maintains urine dilution, reduces oxidative stress, and ensures steady uroepithelial cell turnover. Let's move to lifestyle. Stefan Meyer, an IT engineer from Vienna, developed persistent lower urinary tract symptoms, LUTS, after years of sedentary work. Extended sitting compresses the perineum, causing venous congestion, ischemia, and microinjury to the prostate stroma. Published studies from the Netherlands demonstrate that pelvic stasis impairs microcirculation, accelerating glandular edema and inflammation. The clinical solution, based on Swedish physical therapy standards, is the 30-minute rule. Stand and walk for at least 1 minute every half hour. Perform brisk dynamic stretches or use a standing workstation. Such micro-exercise routines yield measurable reductions in IPSS, International Prostate Symptom Score, as evidenced in multi-center studies across Denmark and Switzerland. Diet is pivotal. David Smith, a chef from Manchester, consumed fried and processed foods daily. His hormone profile revealed falling testosterone, rising estrogen, a direct effect of excess trans fats, oxidized oils, and nitrite preservatives. Data from the Rotterdam Nutrition and Prostate Study show high-fat, high-sodium diets disrupt androgen metabolism, elevate estradiol levels, and activate inflammatory microglia in the prostate. A Mediterranean regimen rich in monounsaturated fats, olive oil, nuts, avocados, omega-3s, wild salmon, mackerel, cruciferous greens, broccoli, kale, tomatoes, lycopene, and berries corrects these imbalances. David transitioned to antioxidant-rich menus, restoring hormone balance, lowering body inflammation, CRP, IL-6, and regaining full sexual function. Now, caffeine management. Luca Rossi of Rome, an investigative journalist, habitually drank 3 espressos daily. Caffeine, a methylxanthine, acts as both a direct bladder stimulant and moderate diuretic. It increases detrusor overactivity, reduces bladder compliance, and leads to nocturia and urgency. Limiting intake to 1 morning coffee and switching afternoon beverages to chamomile or peppermint tea, as recommended by the University of Padua, improved his nocturnal voiding and reduced urgency episodes by 40% within 2 weeks. Behavior patterns matter, especially persistent urine holding. Pierre Moreau, a consultant from Lyon, routinely delayed bathroom breaks during meetings. Chronic bladder overdistension increases intravesical pressure and microtrauma to the prostate capsule. A French urological cohort study established that listen to the first urge is crucial. Void when your body signals, avoid detrusor muscle fatigue and bacterial retention, and protect the entire genitourinary tract. Environmental exposure is next. Peter Johansson, a Stockholm-based architect, never smoked but worked in smoke-filled offices for years. Even passive smoke exposure introduces polycyclic aromatic hydrocarbons and nitrosamines, constricting pelvic microvasculature. Swedish and Danish studies link secondhand smoke to increased inflammation markers and higher BPH and cancer risk. Peter's symptoms abated after moving to a smoke-free workspace and participating in a urologist-led clean air clinic for ongoing support. Preventive medicine is key. Eric Schneider, a Munich teacher, delayed annual checkups for years. Often, prostate disease is silent. Symptoms only emerge when inflammation or neoplasia is advanced. European guidelines advocate yearly PSA blood tests, digital rectal exams, and, where indicated, transrectal ultrasound or multiparametric MRI. Early detection allows risk stratification. Many cases respond to simple lifestyle changes or first-line pharmacotherapy, like alpha blockers, tamsulosin, or 5-alpha reductase inhibitors, finasteride, dutasteride. Dietary sources of protein and fiber matter too. Martin Kowalski in Warsaw preferred steak, sausages, and bacon. Red and processed meats raise saturated fat intake and nitrite load, fostering a pro-inflammatory environment. Balance is crucial. Limit red meat to once weekly and focus on alternatives like omega-3 rich fish, skinless poultry, lentils, beans, and high-fiber grains. Scientific consensus from Germany, France, and Italy correlates these dietary modifications to lower rates of prostate enlargement and fewer LUTS episodes. Body composition impacts prostate health. Blażej Nowak, a Polish athlete, developed central obesity after retirement. Adipose tissue, especially visceral fat, operates as an endocrine organ, producing cytokines, IL-6, TNF-alpha, and aromatase, which converts testosterone to estrogen. This metabolic syndrome accelerates prostate growth and impairs sexual function. Interventions include daily aerobic activity, walking, cycling, swimming, dietary swaps, water instead of sodas, more greens, and incremental weight loss strategies. Even a 5% reduction in total body weight has been proven in randomized European trials to markedly reduce prostate volume and symptom scores. Managing chronic stress is essential. Nicholas Bauer, an entrepreneur from Zurich, lived under pressure, slept poorly, and developed persistent LUTS. Stress releases cortisol, a hormone disruptive to testosterone synthesis and a catalyst for systemic inflammation. European psychological and medical associations now routinely prescribe daily mindfulness, guided relaxation, social contact, and sleep hygiene protocols for men suffering from LUTS. Nicholas's symptoms resolved after implementing a nightly wind-down routine, breathing exercises, and scheduling leisure time. Medication and surgery also play a vital role in therapy. First-line treatments include alpha-adrenergic blockers, 5-alpha reductase inhibitors, phosphodiesterase 5 inhibitors for sexual symptoms, and phytotherapeutics, saw palmetto, pygeum. For moderate, combination therapy is common, including tamsulosin plus finasteride, supported by European Urology Association guidelines. If symptoms persist, minimally invasive and advanced interventions are available across Europe's leading hospitals. Rezūm water vapor therapy uses convective radiofrequency water vapor to ablate overgrown tissue. Conducted under local anesthesia, this procedure preserves sexual function and yields rapid improvement in maximal urine flow. The Da Vinci robotic-assisted prostatectomy offers unparalleled precision for patients with obstructive BPH and prostate cancer, reducing post-operative incontinence and impotence according to multi-center outcomes in seminars across Germany and Switzerland. Laser enucleation, HoLEP/ThuLEP, is preferred for large glands. It utilizes holmium or thulium laser energy to remove the adenoma, resulting in shorter catheterization time and lower bleeding risk. Prostate artery embolization, PAE, is a non-surgical approach. Embolic beads are delivered via microcatheters to selectively occlude the prostatic arteries. It shrinks the gland painlessly and preserves sexual and urinary function, ideal for men unwilling or unable to undergo surgery. High-intensity focused ultrasound, HIFU, is a new frontier, destroying specific glandular regions with precision while sparing nerves. Only select candidates qualify, and outcomes are tracked in European prostate outcome registers. All men should follow annual health protocols, PSA levels, DRE, endocrine assessment, and cardiovascular risk panel. Urine flow studies, uroflowmetry, bladder ultrasounds, and MRI when indicated. Nutritional medicine recommends the Mediterranean diet as gold standard. Emphasis is placed on tomatoes, rich in lycopene, leafy greens, cruciferous vegetables, berries, nuts, Brazil nuts, pumpkin seeds, olive oil, and oily fish. Pumpkin seeds contain phytosterols to reduce BPH symptoms. Soy isoflavones, abundant in Northern European diets, exert protective hormonal effects. Supplements including vitamin D3, magnesium, zinc, and selenium are commonly prescribed in clinical practice. For mental well-being, men's support groups and cognitive behavioral therapy offer robust improvements in quality of life and sexual self-confidence. Effective patient management is interdisciplinary. Urologists, nutritionists, physiotherapists, psychologists, and andrologists work together in European men's health centers. Take action now. The foundation for prostate health is understanding your body, adapting your habits, adopting proven medical science, and scheduling annual doctor visits. Share this video and subscribe for exclusive, ongoing men's health guidance from Dr. Lauren Pierce and her European team. Your health, strength, and happiness are not lost to age. They are restored through knowledge, action, and connection. Before we close, Dr. Lauren Pierce welcomes your comments and questions. Tell us your city, Berlin, Paris, Milan, Warsaw, or Zurich, so our community may grow, learn, and thrive together. Stay tuned for the next expert episode, where cutting-edge science and real stories transform European men's lives. See you as we continue your journey toward lifelong prostate health.